We're changing gears and we're going to consider the vasculature in part 3. So we're going to start by looking at the structure and function of the blood vessels. We're going to move to considering how the blood flows through the vasculature. And as we look at that, the concepts of blood flow, blood pressure, and resistance are going to come into play. And then lastly, we're going to look at how blood volume and blood pressure are more specifically regulated. So to begin, we're going to take a look at blood vessels. Remember, these are dynamic structures, meaning that they can change. And they begin and end at the heart. And so it's a circuit, right? It makes a circular stop and go right at the heart. So remember, arteries carry blood away from the heart. And I point that out because sometimes students think that only oxygenated blood is carried in arteries because it's going away from the heart. But keep in mind your pulmonary circulation. In the pulmonary circulation, you have a pulmonary artery and it carries deoxygenated blood. Arteries eventually lead into capillary beds, and these contact our tissue cells and they directly serve cellular needs. So capillaries are the tiniest blood vessels and they are designed to allow for gas exchange to occur. And third, we have veins. The function of veins is to carry blood back towards the heart. And most of the veins carry deoxygenated blood. That's why they have a deeper color. So sometimes we can see if we have fair skin, the veins through our skin, they look blue, deoxygenated blood. But again, remember your pulmonary circulation. The pulmonary vein is going to be carrying oxygenated blood back to the heart. So most blood vessels we can categorize by having the same type of anatomical structure. So they start out and they have what we call a tunica externa. So tunica is another word for coat. Think tunic. The tunica externa is going to be made of connective tissue that's there to give structure and hold our blood vessels in place. The tunica media for middle coat is normally smooth muscle. So I think media, muscle, both begin with M. And then the tunica interna, or sometimes it's called the tunica intima, is the innermost coat. And here the important layer is going to be the endothelial cells. So the endothelial cells, if you remember, play a very important role in our blood clotting, coagulation. They release a lot of mediators because they're right in contact with the blood itself. We can add some other information to the tunics. So if we take a look at this chart, we can see our tunica intima. The important component here are our endothelial cells or the endothelium. What's important is it's selectively permeable. And it's selectively permeable, and that allows materials to enter or leave the bloodstream. When we get there, you'll see that your capillaries are a single endothelial cell, and that allows for easy gas exchange. The tunica media, so that's the middle, and it's generally the thickest layer because it has smooth muscle. That smooth muscle is going to strengthen the blood vessels, and that also will help to prevent blood pressure, surges in pressure, from rupturing vessels. And remember, muscle can contract or relax, and that gives us vasomotion, or the changes in the diameter of the blood vessels from either contraction and constriction or dilation. The outermost coat, the tunica externa, and that's our connective tissue, and it's there to anchor our blood vessel. It also provides a passage for nerves, lymphatic vessels, and depending on the size of the blood vessel, it can contain what we call the vasa vasorum, which is the blood vessel's own blood supply. So blood vessels are an excellent example of different structures giving rise to different functions. In this image, we can see an artery and a vein and how they vary in those tunics. So the artery's tunica media right here, much thicker than what you see in the vein. So there's more smooth muscle in an artery than a vein. And that allows this artery to have more vasomotion. So it can constrict and dilate, much more so than that vein. It'll also allow it to handle a higher blood pressure than the vein. This vein with this thinner tunica media gives the vein less tone. So the lumen, or the opening here, you can see it's much, much wider. way less tone, much larger as well. And that allows this vein to hold more blood than the artery. And that's why we call veins, sometimes you'll hear them called capacitance vessels. Most of our blood at any given time is actually being almost stored in veins. So we're going to break down the 3 types of blood vessels that we have and list some specific important points of each that will be helpful as we move forward to look at our pathologies. So to begin, there are 3 types of arteries. So our first type are called elastic arteries. And these are large, very thick-walled arteries that have elastin in all of their tunics. These are called the great vessels, or these are the blood vessels that are the largest and closest to the heart. For instance, the aorta and the pulmonary arteries. These have a very large lumen that allows for low resistance to make it easier on the heart to eject blood into them, and they act as a pressure reservoir. That means they can handle a great deal of pressure because they have the ability to recoil. That elastin acts just like elastic, so it can expand and recoil as blood surges through that vessel. This also allows that vessel to maintain its shape over time, and it won't break down under those continual pressure surges. So distal to the elastic arteries then are the next type, the muscular arteries. And these are called that because they are characterized by a very thick tunica media with a lot of smooth muscle. These are also called distributing arteries because they can deliver blood to the body's organs. Not all of our organs receive the same blood supply at any given time. Our blood gets shunted to where it's needed the most at any given moment, depending upon our metabolic activity. So the smooth muscle here allows these distributing or muscular arteries to be active in vasomotion. So they can constrict and dilate, and that allows them to send blood to where it's needed. The last type of artery we're going to discuss are the arterioles. These are the smallest arteries, and they lead right into a capillary bed. They can control flow into the capillary beds via vasomotion. So here again, they can shunt blood or send it elsewhere or not perfuse the capillary bed if the blood is needed elsewhere. So if we take a look at this, then let's look at our big artery here. So with all of this smooth muscle, we would expect this to be a muscular artery. And then leading off of it into a capillary bed would be an arteriole. And so here again, you can see that tunica media has smooth muscle, so we can constrict or dilate. And this is going to lead right into a capillary bed. So we've talked about vasomotion, meaning vasodilation or vasoconstriction. And the arteries can control blood flow by vasomotion, or remember, that's the movement of the blood vessels. So blood vessels can change the flow of blood then by dilating, and that would allow more blood to flow under less pressure. With vasoconstriction, there's an increase in pressure, and that allows less blood to flow through a blood vessel. The endothelium in the tunica interna plays a very important role in being able to control that vasomotion. So it can actually release factors that can either cause vasodilation or constriction. So the image here is going to give us an example of how that works. So here, our endothelial cells are producing nitric oxide, or NO. And it can do that from the precursor L-arginine and oxygen. That nitric oxide then that's produced can diffuse to the smooth muscle cells. And when it gets to the smooth muscle cells, it causes those muscle cells to relax, and then it causes vasodilation. So along with our endothelial-derived factors, the autonomic nervous system can also influence our arteries and their vasomotion. So input from the sympathetic nervous system is called sympathetic tone, and neurotransmitters like norepinephrine generally cause vasoconstriction. We also have other factors from the epithelium that can cause vasoconstriction as well. So our capillaries are next in our organization, moving away from the heart. So these are microscopic blood vessels. and we refer to them as being capillary beds. If we look at their structure, they're only one cell thick, and they do have a basement membrane, and they get help from cells called periocytes to help stabilize and strengthen them. Being made of only that tunica interna, it allows incredible permeability to these vessels, and it gives rise to their function, which is to exchange materials between the bloodstream and the interstitial space, or the area around the cells of a tissue. Capillaries have a very tiny lumen, and it actually only allows one single red blood cell to pass through at a time. And that greatly reduces the blood flow, and it allows time for the exchange of gases, nutrients, wastes, hormones, etc. to be able to occur. If blood was moving very, very, very quickly, we wouldn't have that same type of exchange. So there are capillaries everywhere except in cartilage and other connective tissue like tendons and ligaments where you have collagen. And the reason is because in those places, like for instance with cartilage, pressure from the joint movements would destroy these very delicate blood vessels. We also don't have capillaries in the cornea and lens of our eye because their presence there would block our vision. It's estimated that in a given tissue, cells would only be about 6 cell widths away from a capillary in order for there to be the right amount of diffusion of these materials without cells becoming, for instance, hypoxic, not being able to exchange with that capillary. Our muscles, kidneys, liver, brain, they generally have the most capillaries, and so then they are the most profuse or have the most blood flow within them. So we can see here that capillaries then link the arteries to our veins. So after exchange occurs in these capillaries, we generally have deoxygenated blood, and now it needs to be sent back to the heart. And so our veins are responsible for bringing blood back to the heart. Capillary beds lead into the first type of vein, which is called a venule. So venules are still very porous, and that allows them to take up fluids, some white blood cells, back from our tissues. Venules lead into veins, and veins start to make their way back to the heart, carrying the deoxygenated blood. So as we've already looked at, veins have thinner walls, larger lumens, compared to their corresponding arteries. This gives them lower blood pressure. The thin tunica media and thick tunica externa with a lot of collagen and a lot of elastic allows the veins to store blood. They're also called capacitance vessels or blood reservoirs. About 65% of the blood supply can be found in the veins at any given time. Like I mentioned, veins do have low blood pressure, so they need to get the blood back to the heart somehow. And most of them actually have to get the blood back against gravity. So veins have adaptations in them to assist in the return of blood back to the heart. The large diameter of their lumen creates less resistance, so it's easier to move blood, and they contain valves that prevent the backflow of blood. So it's continuously moved towards the heart. So here you could see a vein with a valve in it, and this valve is closed. So once blood gets pushed or squished through this valve, it can move through the next one. When it closes, the blood will be caught by the valve and it won't backflow. So for instance, say that this is a leg, it's not going to backflow and pool in the lower leg. The way the valves open is by pressure. So as your muscles in your body move, they change size and shape. Think about flexing a muscle. And that is going to squish the vein. And when it does, it will push the blood through another valve and it becomes one step closer to the heart. And so we call this a skeletal muscle pump. Here you could see an example of that. So here are relaxed skeletal muscles. And when you move, they contract and push that blood back towards the heart. A couple important points here. People who are immobile, we worry about them having blood clots. The reason is because the blood can pool within these veins if these muscles are not moving. And so once a blood clot forms, then if it does become an embolism and start to move, it's going to go towards the heart and then towards our respiratory system, and it can become a pulmonary embolism. So people who are immobile or don't walk very much and are not moving these muscles, we can prescribe them compression socks. And those are socks that go pretty high up the leg, and it acts like these muscles to keep moving and squishing blood through those valves so it can keep moving towards the heart. So these two charts show us by the numbers some of the features of the vasculature that we've been highlighting. So here at the top, we can see pressure, and we can see pressure changes all the way through the circulatory system. And if you look here, the pressure has this big squiggly line. So what's giving it that squiggly line? Remember, the heart contracts and then it relaxes. So we have pressure surges. So here you can see is the left ventricle. That's where we have the highest pressure. And then the blood vessels closest to the heart and the arteries have the highest pressure. So thank goodness for that tunica media that can take those pressure surges. Once blood enters the capillaries, we have a very large decrease in pressure. So those are low pressure vessels. And then the veins are very low pressure as well. We don't see the pressure coming back until we get into the heart again. The pressure starts coming up a little bit here. You can see in the right ventricle, pulmonary artery. But when that blood gets back to that left ventricle and it gets that big surge and into those arteries, again, then you see the high pressure. If you look at the total blood volume, so you can see at any given time, about 16% of our blood volume is going to be in the artery side of the circulation. 64% of it is in the veins. So capacitance vessels. And again, that tunica media is what's doing that. It's thinner. It allows for that bigger lumen. And so the blood can pool there. We're now going to take a look at hemodynamics. And this is the principles of blood flow. And so we're referring to the physical principles now that govern how blood flows through the circulatory system. It's not one smooth, continuous flow through a uniform tube. So those blood vessels change their diameters. By changing diameter, they change pressure. Disease processes can affect how the blood flows and the pressure in our vessels as well. And so we have to understand the basics to then be able to understand how pathologies can change how blood flows and our blood pressure. We're going to look at blood flow first. So by definition, it's the volume of blood flowing through a vessel or an organ or the entire circulation in a given period of time. It's measured in mils per minute, and it's the equivalent of our cardiac output. Flow is relatively consistent at rest, but it varies widely through individual organs based on the needs of the tissues at a given time. Ohm's laws show us that when there's a relationship then between blood flow, pressure, and resistance. So physics then is going to show us this relationship between blood flow, pressure, and resistance. So if we take a look at our equation here, flow equals changes in pressure divided by resistance. If we were to take any length of a blood vessel, so let's say we take a blood vessel that's 12 inches and measure the pressure at two different points and take their difference, that's going to give us the change in pressure across that given distance. So the change in pressure divided by the resistance is going to equal the flow of blood. So let's consider a couple things. First, normally, the change in pressure is taken between the arterial end and the venous end, say entering an organ or a tissue. And for the most part, blood pressure is tightly regulated, and it doesn't change drastically. So we can consider, for our purposes in looking at mathematical principles here, we can consider it pretty constant. So resistance can change, and when it does, it's going to affect the flow. So from the equation, we can see that flow and resistance are inversely proportional. So that means as resistance increases, blood flow would decrease. And as resistance decreases, flow is going to increase. So like I mentioned, pressure will not change drastically, but when it does, it is proportional. So an increase in our blood pressure will increase our blood flow. Now, velocity is the rate of forward movement of the blood, and it's inversely related to the total cross-sectional area of the blood vessels. So the smaller the area in the blood vessel, there's not going to be as much lateral flow and only forward flow, which would increase the velocity. So in the figure, we can see that in this second section here. If the cross-sectional area increases, blood can flow laterally as well as forward, and that would decrease velocity. And we can see that in our areas 1 and 3 here. In the vasculature, the smallest cross-sectional area would be in the great blood vessels, and that's where we see the greatest velocity. As the arteries branch into the arterioles and capillaries, if you were to count and combine all the cross-sectional area, it increases a lot, and that's why we see velocity decrease as blood branches into those areas. This fits the function of capillaries perfectly because the sluggish movement and lower velocity then allows for adequate time for the gases to be exchanged as well as the nutrients, wastes, etc., and allows time for those things to move between the bloodstream and the tissues. Resistance greatly affects flow, as by definition, it's the opposition to flow. So think about it in terms of people. Someone that is giving you resistance on something, they're just not going with the flow, so to say. The same thing goes with blood. Resistance is the measure of the amount of friction blood encounters generally in the peripheral systemic circulation. So there are 3 important sources of resistance: blood viscosity, the total blood vessel length, and blood vessel diameter. We're going to talk about each of those then to understand them further. For the most part, the first 2 factors that affect resistance stay relatively constant. Blood viscosity is the stickiness of blood due to the formed elements and the plasma proteins. It's related to the internal friction of the components of the blood moving past one another. Low viscosity fluid would be water. There are very few particles in water, so it would easily pour right out of a glass if you had a glass of water and tipped it upside down, right? We've all experienced that. The low viscosity gives it very high flow. Compare that to a glass of honey. Honey has a very high viscosity or stickiness, so it has very little flow. You could turn that cup of honey upside down, and it takes a very long time for it to flow out. Compared to water, blood has a higher viscosity, and this increases its resistance. The other factor that influences resistance here is blood vessel length. The longer the blood vessel, the greater the resistance is going to be encountered. Think of running through a wind tunnel. Have you ever run against the wind? Or even think about swimming upstream. If you have to swim upstream or paddle upstream, is it easier to go a short or long distance? Well, shorter, of course, right? The shorter you have to go against the flow, so to say, the less resistance, and it's going to be easier. When we're fully grown, our blood vessel length stays pretty much constant unless we gain weight or fat tissue. Generally, increases in tissue would mean increases in blood vessels because it would be needed to perfuse that tissue. So this is why there's a greater risk of high blood pressure with obesity. The last component that affects resistance is blood vessel diameter. The larger the diameter of the blood vessel, there will be more blood flowing in the middle of the vessel and at a higher velocity because it's avoiding friction of the blood vessel wall. And that's called laminar flow because it's layered with the plasma closest to the blood vessel wall, and the formed elements then just slide past it with each layer sort of picking up velocity. You can see that similar idea of like laminar flow in rivers. So the middle of a river has the highest velocity because there's less friction, there's less rocks, less trees created by the banks. But by the bank, where you have rocks and trees, maybe decks, boats parked, it has the slowest velocity because that water is going to have contact with those things and it creates friction. So a decrease in blood vessel diameter can cause turbulent flow or a whirlpool effect that decreases velocity, and we would need greater blood pressure to maintain the flow of blood. So here you could see is that laminar flow where the blood flowing in the middle is going to have the greatest velocity. And here you can see is constriction, and that's creating turbulent flow. So vasomotion can change that blood vessel diameter then, and pathologies can also create narrowing in our blood vessels that affects diameter. The last component that affects blood flow is blood pressure. This is the force per unit area exerted on the wall of the blood vessel by the blood, and we measure it in millimeters per mercury. It's measured as a systemic arterial blood pressure in the large arteries near the heart, for example, the brachial artery in the upper arm. Its pressure gradient provides the driving force that keeps the blood moving from higher to lower pressure areas. So the pressure is greatest at the heart and it's lowest at the capillaries and into the veins. The pressure results when blood flow meets resistance. The main factors that influence blood pressure are peripheral resistance, blood vessel elasticity, blood volume, and cardiac output or flow. So we can see that these factors are related to one another in the equation for blood pressure, which is blood pressure is equaling cardiac output times peripheral resistance. If resistance or the opposition to flow increases, so does the blood pressure. If flow or cardiac output increases, so does blood pressure. Likewise, if either cardiac output or resistance decrease, then we'll see a decrease in blood pressure. We've seen this chart before, but it's good to show it again as now we're looking at blood pressure. You can see blood pressure is going to be highest in our elastic vessels or great vessels closest to the heart, and then blood pressure is going to be decreasing, and it's lowest where you have the lowest resistance in those veins. I've laid out this chart to allow us to see factors that affect blood pressure because there are many. So there's the four main ones that we can see up at the top: resistance, elasticity, blood volume, and cardiac output. But if we look under each of these, there are many numerous factors that can influence our blood pressure as well. So for instance, with diameter,